We are in Bologna for the IBS Bologna Days 2016, an international congress who made the point for irritable bowel syndrome. And we have the privilege to speak with the president of the congress, with Professor Giovanni Barbara, and for knowing the key messages of the congress. Professor Barbara, a general comment about IBS 2016.
IBS in 2016 is a meeting that sees many participants from all over the world. We had 400 people that gathered together here in Bologna for this meeting, and a very important faculty coming from Europe, Italy, North America and Asia. So I think that in this meeting we had the opportunity to listen to very important messages from the faculty that led the people to understand what are the novelties in terms of diagnosis and also therapy of the irritable bowel syndrome. So I think that there are several important messages. The first message is that we now have very potent instruments to make a good diagnosis in these patients. I'm referring to the Rome 4 criteria. The Rome 4 criteria are the criteria that have been written basically and decided and just came out at the DDW in 2016, just a few weeks ago. And settle the guidelines basically for the diagnosis and management of these patients. And also there are new therapies that now we can use in these patients. In particular, I'm referring to those that we already have. I'm referring, for example, to rifaximin, which is a modulator of the microbiota, but also new drugs that are coming out in the market. Linaclotide is getting into several different markets all over the world, but also eluxadolin, which is coming out in several different countries. And these drugs obviously are a good addition for clinicians to those that we already have. I'm talking about antispasmodics, probiotics, and also we should mention that in these patients we can use also changes in the diet and the lifestyle, which are very important, particularly for those who have milder symptoms.